Preparedness and response are at the heart of disaster nursing. Every nurse, whether in the hospital or the community, has a role in recognizing risk, responding quickly, and minimizing harm when a disaster occurs. Being prepared means more than knowing where the emergency cart is. It means anticipating what could happen and having a plan for how to keep both patients and staff safe when it does. Preparedness begins with recognition and awareness. Communities must have contingency plans that help protect the most vulnerable people: older adults, people with disabilities, and those with limited access to transportation or medical care. These plans should ensure everyone has access to life-sustaining resources and clear guidance for evacuation if needed. Preparedness also includes understanding that some threats are not visible. There's always the potential for the covert use of weapons of mass destruction, agents that cause widespread harm or death. These could be chemical, biological, or radiologic in nature, and many are colorless, odorless, and difficult to detect. Nurses must be aware of the signs of deliberate exposure or an emerging outbreak, and they must act quickly to protect themselves and others through early detection, containment, and decontamination. Nurses are often the first to notice unusual patterns. A sudden increase in patients with fevers, coughs, or severe gastrointestinal symptoms may point to a new infectious agent. Clusters of similar illnesses, especially among people from a shared event, school, or neighborhood, should raise suspicion. A rise in deaths within 72 hours of admission or illness in an otherwise healthy population are also red flags. When these patterns appear, nurses are responsible for reporting them immediately to infection control, the state health department, and the CDC. Taking a thorough history becomes critical in these situations. Beyond the standard admission questions, nurses should ask about a patient's occupation, travel, environmental exposures, and even hobbies. Someone's daily routine or a recent trip may hold the key to identifying the source of exposure. The environmental history should include where they live, their water supply, and any unusual changes in daily life. The occupational history might reveal contact with toxins, chemicals, or people recently ill. These small details can lead to the early recognition of an outbreak and prevent further spread. Hospitals rely on several resources to identify and report potential exposures. The Infection Control Department, Poison Control Center, State Health Department, and the CDC are all part of that network. Nurses can also refer to the Material Safety Data Sheets, or MSDS, which outline chemical ingredients, hazards, and proper response steps for specific substances. Prompt and accurate reporting provides valuable data for epidemiologists and can literally save lives by stopping an outbreak before it grows. During the COVID-19 pandemic, the patterns of illness shifted as the virus evolved. Early on, it was thought that children couldn't become infected, but as time went on, that assumption changed. Children did get infected, although most experienced milder symptoms than adults. Later, pediatricians began seeing a new and frightening condition: multi-system inflammatory syndrome in children, or MIS-C. This rare but serious condition caused widespread inflammation in the heart, lungs, brain, and other organs. The CDC quickly issued warnings so that providers could recognize it early. The lesson here is that patterns change, and nurses must stay alert as new information emerges. Another key part of preparedness is protecting healthcare workers. Nurses cannot care for others if they themselves become victims. Personal protective equipment, PPE, is the barrier that stands between the responder and the hazard. It's designed to protect against chemical, biological, physical, and radiologic threats that may not be immediately visible. The Environmental Protection Agency defines 4 levels of protective equipment, A through D. Level A provides the highest level of protection. This includes a self-contained breathing apparatus and a fully encapsulated chemical-resistant suit. It's used when both the respiratory and skin exposure risks are high. Level B still requires the self-contained breathing apparatus, but offers slightly less skin protection, used when respiratory threats are severe, but full vapor protection isn't necessary. Level C includes an air-purified respirator with a chemical-resistant coverall, gloves, and boots. It's what most hospitals would use for average contamination cases. Level D is the standard work uniform used for minimal risk situations. It's our everyday scrubs with gloves or a mask added as needed. Levels C and D are what we typically see in hospitals. Level D, our usual standard precautions, isn't enough for contaminated patients. For those cases, level C is needed, which may include a splash suit and a full-face respirator. And under no circumstances should anyone wear PPE they haven't been trained and fit tested to use. Proper training and testing are non-negotiable for safety. The N95 respirator became a symbol of protection during the COVID-19 pandemic. This mask filters out at least 95% of airborne particles and protects against small aerosols and large droplets. In ideal practice, it should be discarded after each patient encounter or any aerosol-generating procedure. A mask must be replaced if it's damaged, wet, dirty, or no longer forms a good seal. A surgical mask, on the other hand, protects against splashes, sprays, and larger droplets, but doesn't filter airborne particles. It's also meant to be single-use. The CDC provides clear guidance on when an N95 versus a surgical mask is required. Each N95 must be individually tested and approved for fit according to facility policy before use. Decontamination is another essential piece of disaster response. It's the process of removing or neutralizing harmful substances to prevent secondary contamination. Every hospital must have a clear decontamination plan that outlines procedures, equipment, and disposal methods. Effective decontamination has at least 2 steps. The first is removing the patient's clothing and jewelry and rinsing them with water. That alone can remove the majority of contaminants. The second is a full soap and water wash, followed by a rinse. Facilities must be ready to perform these steps before a patient enters the building, especially if pre-hospital decontamination wasn't completed. The so-called walking wounded may arrive on their own, still carrying hazardous materials on their bodies or clothing. Here's a key safety reminder. Never assume that a patient arriving from the field has already been decontaminated. Always verify and, if in doubt, repeat the process. That extra caution protects both staff and patients. Preparedness and response aren't just about procedures. They're about vigilance, communication, and courage. The nurse's awareness, critical thinking, and commitment to safety are the foundation of disaster readiness. Whether it's a chemical exposure, a contagious disease, or an unknown toxin, the nurse's calm, observant presence can mean the difference between chaos and control.